Conservative MP James Brokenshire has been described as a loving father, devoted husband and faithful friend by his family.
Yes, the former Home Office Minister has died of lung cancer at the age of 53, and his fellow politicians from all sides have been paying tribute to him.
Boris Johnson said he was desperately sad to hear the news and described him as the nicest, kindest and most unassuming of politicians.
Former Prime Minister Theresa May also paid tribute to what she called an outstanding public servant, a talented minister and a loyal friend.
While Labour leader Sir Keir Starmer described him as a thoroughly decent man who fought his illness with dignity and bravery.
Well, the former government advisor, Peter Cardwell, who worked for Mr Brokenshire, had this to say.
James was the best of politics and he was the best of humanity. He was my boss who became my friend, and he was someone who was very serious about politics, very serious about the job he did, very ambitious and got to the very highest levels, 2 cabinet roles, but he also didn't take himself too seriously.
Brokenshire there, James Brokenshire. Well, we're joined now by Mandee Lucas, who's a trustee for the Roy Castle Lung Cancer Foundation, which James Brokenshire was a keen supporter of, and also by Karen Harrison-Phipps, who's a surgeon who treated James. Good morning to both of you.
Good morning.
Karen, can we start with you? I know you came across him in a professional capacity, but what's striking is the number of people who knew him from all sides of politics and personally just say he was a thoroughly decent guy. What was your experience of James Brokenshire?
Absolutely. Obviously, I can't comment on the individual care he received, but he had the common touch. He took time to be interested in the nurses, the wider team. He was concerned, and it was his goal to raise awareness for lung cancer. So even at that time of great concern for himself, he was only concerned for others, the wider team around him, but more importantly, patients in the future who may develop lung cancer. And he wanted to raise awareness for patients who may develop symptoms. And so, you know, it's vital that we get that message out, that anyone who is there that has concerns to come forward and seek help. So he had the common touch. He was able to connect with people on that level and show concern.
We'll come on to symptoms and diagnosis in a moment, because one thing I didn't realise is you wouldn't necessarily know, you wouldn't necessarily feel that you had poorly lungs, but just to bring you in, Mandee, you met him via social media.
Yeah.
Did you introduce yourself to him?
I did. So I had lung cancer 5 years ago, and I'm just about to get my 5-year all clear, I hope. But when I read, actually I saw it on Breakfast BBC, that you had an article about him, and I reached out to him and just said, can I help? Are you okay? He had the same cancer in the same place at the same diagnosis, and he's the same age as me, so I felt like we had something in common. And we messaged backwards and forwards just a couple of times. I just wanted to reach out to see how he was doing, really.
That's so kind. And how are you doing?
I'm okay. I mean, I went through the rungs. It's hard. The treatment's hard. The surgeries are really hard. But so far, I'm one of the lucky ones. I'm okay. Thank you.
So you're waiting for your 5-year all clear?
Yeah, so I've been clear for, in 5 months' time, I have a scan, and we'll see whether that's 5 years. At 5 years, you're assessed as cured rather than just NED, which is no evidence of disease. So
keeping everything crossed for you.
Exactly. I'm a little bit nervous at the moment about it, but
Jen, it must make this particularly hard. You know, seeing what's happened to James, it sort of puts it all into perspective.
100%.
Yeah.
I looked back at my tweets yesterday trying to find where I first met James, and it was actually, as I said, on this programme, I'd noticed it, and I'd taken a screenshot, and you had some really scary statistics about lung cancer, and it was something along the lines of only 10 out of 4,000 people survive after 10 years, and I'd actually written on the bottom, let's hope we're 2 of the 10. So it was very poignant. When I saw his name flash up yesterday on the news, I knew what it was, and it really hit me, actually. I feel like almost a little bit of survivor's guilt, because I was so lucky on so many different ways with my cancer diagnosis, and he wasn't. But it's so important to get this, you know, get out there, and if you have any symptoms, go and see someone and push for a diagnosis.
And from what Karen was saying a minute ago, he would absolutely want you to be here this morning, getting the message out and promoting the cause. Karen, can we ask you, because what really strikes, I think, so many of us is the fact that James Brokenshire never smoked a cigarette. And I think we all associate lung cancer as being the result of smoking, but this is proof that it's not always the case.
Very rarely.
I think that's right. And I think that's one of the messages he wanted to get across. He wanted to make it clear, it can happen to anyone. And we should stop, acknowledging the stigma around lung cancer only associated with smokers. Of course, it's not great if you smoke. Of course, it's the right thing to try and reduce and stop and take measures to improve your health. But in fact, it can strike at anybody. And that was one of the key messages he wanted to get across, and also to come forward earlier, because we do know that the earlier lung cancer can be picked up, the results are far better. And although he was a non-smoker, the results are better with treatment if you are a non-smoker. So there's some important messages to get out. But the key thing is, it can happen to anybody, and even at any age, although it is more common as you get older.
And Mandee, what were your symptoms? Because often they can be silent, can't they?
Completely silent. So I had 0 symptoms.
Right.
I had an unrelated scan, and thank goodness the radiologist found a nodule on my lung on that scan where he was looking at my pancreas. So he wasn't even meant to be looking at that area, and he saved my life. It was tiny, it was 7 millimetres, and I had 18-month wait to get it taken out. Gosh. Because I had to beg them to take it out because they really didn't think it was anything. And then when they did take it out, it was stage 3, so it was tiny but deadly. So I definitely wouldn't be here if it wasn't for that radiographer doing a very, very good job on that scan.
And your persistence.
Definitely. So, I feel like my reason for being here, not just at breakfast, but living, is to kind of get the message out that you have to be your own advocate. Right. You have to make sure that you get the treatment you want. So I suppose my message would be, sorry, I'm probably going a bit off here, but
it's so important.
My message would be to anybody, if you have a cough, I had no symptoms and it could have killed me, and they could see it and I had to beg for them to take it out. If you have a cough, if you have any kind of symptom, go and see your doctor. And if they give you antibiotics, that's fine. Take the antibiotics for 2 weeks. But if they don't work, don't take months and months of antibiotics. Go back and demand a simple chest X-ray, because that, although it won't diagnose cancer, will diagnose something on your X-ray, and that can be followed up with further scans and hopefully a diagnosis one way or the other.
And just to stress, you were talking about the similarities between your case and your age and your timing with James Brokenshire.
Absolutely.
Another thing you have in common with him, you also not a smoker.
Never smoked in my life. Never, ever smoked. I absolutely hate it. Never touched one. So it was a real shock. And I wasn't expecting it because I had no symptoms. So the whole thing was fairly shocking. And I feel like I'm the luckiest girl in the world. I had a 22% chance of getting through the cancer, and I had a 22% chance of being here 5 years later. So, touch wood, that's going to happen.
You're 5 months away from that.
I just want to, yeah, absolutely. And I just want to tell people, don't be scared of the treatment. It is horrible, but being alive is more important. And you can get through those couple of months of horridness to be alive and live the rest of your life. It's so important just to get seen.
And Karen, how important is what Mandee said, that sometimes people feel unwell, they know something isn't right, but they don't want to cause a fuss, they don't want to go to the GP and put pressure on them. How do we know when we should be paying attention to our bodies with this?
Well, I think the patient knows best. I think often you speak to people and they'll say, I just didn't feel right. But of course, there are some cardinal signs and symptoms that you cannot ignore. So if you have coughed up blood or you do have a persistent cough, I think it's vital to seek help. But even if you're just feeling fatigued for a prolonged period, it's very worth visiting your GP. And I know, of course, there's press about GPs working hard or not able to see, appointments delayed. I think what Mandee says is important. Persistence. Don't let it slip. Don't ignore it. Do seek help. There is help there. And certainly, although with the pandemic, there was concern we weren't giving treatment, that was just not the case. We worked through the pandemic. We treated 500 patients in London with lung cancer surgeries. So it's vital that we are here as a team. We're ready to help anybody who's got any concern that they may have a lung cancer. It's so important to seek help. And the other thing I would say is that, people are afraid, really. People are afraid to come forward because they're afraid of the diagnosis of lung cancer. And one of the vital things to realise is that the results are getting better all the time. It's not the disease it was in the past. There's newer treatments coming all the time. Surgery is improving. chemotherapy is improving and new targeted therapies are improving. So there's great optimism for the future. So do come forward. Don't be afraid.
Well said. Thank you so much. Karen, thank you for joining us and your expertise. And Mandee, thanks for sharing your story and encouraging people this morning. We have got everything crossed. In fact, imagine out there are millions of fingers crossed looking ahead to your scan in a few weeks' time. We're all with you.
Can I just say one last thing?
Yeah.
If you do get a diagnosis, please get in contact with Royal Castle Lung Cancer Foundation. They have everything you need, pre-diagnosis, post-diagnosis, nurses you can speak to. So please get in touch with them because they are the only lung cancer charity in the country and they do an amazing job.
Mandee, thank you so much. You are amazing.
Yeah.
You are incredible. Yeah, we are keeping everything crossed for the next 5
Thank you so much.
Thank you,
Thanks for having me.
Let's check in with Susan then for an update.